2.
Hi, I'm Dr. Carla Denton from Sooner Veterinary Hospital, and I'm here to show you how to do a physical exam on a cat. And here we have 12 to 14-week-old Bethany, a female domestic short hair that came from a little barn. So first of all, what I do with her is I look at her face. I look at her eyes, I look at her nose, I look at her mouth. I look at her eyes to see the pupils, the iris, which is the green part of her eye, and I lift this up to see the white part of her eye, which is called the sclera. I look into her eye with this device, and that allows me to see the retina and the optic disc. There should be 3 blood vessels that go through that, and that helps me determine if the retina is attached or detached. Next, I open her mouth and I look at her teeth, and you can see that she's starting to get some adult teeth. I look at the color of her gums, which are nice and pink. I open her mouth, I look at her tongue, make sure there aren't any ulcers. I look at the top of her mouth to make sure that she doesn't have a hole up there, which is called a cleft palate. I look underneath her tongue to look for a string to make sure that she hasn't eaten anything that she shouldn't have. Next, I look at her ears. I look at the outside of her ear first to make sure that it is nice and clean of each ear. There, she'll cooperate. There we go, baby. I look inside her ear. What you want to see is a nice clean ear canal. And you go all the way down. The ear canal makes a 90-degree turn, and deep within that you can see the eardrum, and that should be a nice light pink color. Now she has a little bit of dirty ear, and so I suspect that she is recovering from an ear mite infection. She's very sweet. Next, what I do is I start to feel lymph nodes, and she should have some lymph nodes up here and here. And then cats and dogs also have lymph nodes back here that are easy to palpate. Then what I do is I feel on her abdomen, and typically they're standing for this, but since she's so cooperative and she rolled over for us, I figured we'd go ahead and feel her like that. I try to go ahead and feel the bladder as well, and that helps me determine the hydration status of a cat. The other thing that I do to determine hydration status is to check for skin tinting. If the skin tinting is increased, then I know that we are slightly dehydrated. And then I take a listen. And the best place that I can typically hear the heart is on the bottom of the chest, right here. Sometimes you can hear it here or here, but since she's purring very loudly, in fact, I find that I can hear it best in this location. I listen her lungs, and they should be clean and clear of crackles or rasps, which they are. I check her hair coat, and even though that she's a black cat, sometimes you can see fleas, but they're much harder to see on a black cat, but I haven't seen any evidence of fleas or other external parasites. I check her paws. She obviously has claws that have been recently trimmed. All there. Cats shouldn't have dew claws on the back. Look at her tail, and she looks relatively healthy for a young kitten. Thank you for joining us for the cat physical exam.